Hello, everyone. It's your girl, Dr. Elizabeth Elo. I'm a registered pharmacist in the state of Illinois. Today, we shall be talking about our first disease state, which is diabetes. So, I'm going to take some time to explain about what diabetes is. What are the types of diabetes? Some clinical presentation of diabetes. What are the risk factors for diabetes? And I'll also end this video by answering some of your questions that you might have. You can post your questions in the comment section and I'll be there answering all your questions. So, what is diabetes? Diabetes is a chronic condition, is actually a disease state that affects millions of Americans in the United States and millions of people all over the world. Here in the United States, we have more than 30 million people that have this disease state. So, what is actually diabetes? Diabetes is a disease that is associated with the impairment in insulin secretion. So it is basically an abnormality in how insulin is being produced and how insulin is being used in our body. It is basically characterized by a high blood glucose, which is medically called hyperglycemia. There are three types of diabetes. The first is the type 1 diabetes. We also have what we call type 2 diabetes. And we also have gestational diabetes in pregnant women. What are some of the clinical presentations in people that have diabetes? Number one, people with diabetes are mostly asymptomatic. That means they don't really show the sign that they are really having this disease. But what we normally see mostly in people that have this disease is that they have excessive urination, they frequent the toilet often, they have excessive thirst, and that is because as they are urinating more frequently, they become more thirsty and then they drink more water. People with diabetes also have excessive hunger and increased appetite. They want to eat more often. They are more fatigued. They are just weak and they feel so sluggish. Most people with diabetes have blurry vision, and for the men, they experience erectile dysfunction. And for most women, they experience vaginal fungal infections. Now, what are the risk factors in people with diabetes? Number one, physical inactivity. For people that find it difficult to exercise, to burn the excessive fat and glucose in the body, they have a higher risk of having diabetes. People that are obese or overweight, that have a BMI that is greater than or equal to 25 kg per meter squared. Race and ethnicity also play a role in diabetes, as we see most patients with diabetes are from the African descent and from African American descent, from Asian American, Latinos, and even Native Americans are at high risk of having diabetes. Women that have history of gestational diabetes during pregnancy, people with an A1C that is greater than or equal to 5.7% are at higher risk of having diabetes. People that has their first relative with diabetes, for example, if your father or your mother has diabetes, you're also likely to have this disease. People that has an HDL, a high density lipoprotein that is less than 35. Now, a normal HDL should be greater than 40. So people that has less of this good lipoprotein have the tendency of developing diabetes, or people that have a triglyceride level that is greater than 250 milligram per deciliter. People that smoke a lot are also at higher risk of developing diabetes, and patients with hypertension also have the risk factor of developing diabetes. Now, what are the various types of diabetes? I explained it briefly, but now I'm just going to talk more about the different types of diabetes that we have. Type 1 diabetes is an autoimmune destruction of the beta cells in the pancreas. Now, these beta cells are responsible for producing insulin. Now, when your own body attack these beta cells and destroy them, the person actually stop producing insulin, and we see this type 1 diabetes mostly in children or in childhood. Type 2 diabetes, on the other hand, is more than type 1 diabetes, and this is because it is a progressive loss of the insulin secretion from the beta cells. Now, this patient, they become insulin resistant and they become insulin deficient. Type 2 diabetes are more common in adults, and this is because it is something that progresses over time based on the risk factors that I explained earlier on: physical inactivity, people that are finding it difficult to exercise to burn off the excessive fat or the excessive glucose, tend to develop this type 2 diabetes. Diet also play a significant risk factor in developing type 2 diabetes. If for patients that consume a lot of starchy food, or food that are high in carbohydrate, tend to develop type 2 diabetes easily. Gestational diabetes is diabetes that develop during pregnancy in women that are um, maybe due to pregnancy they develop this insulin resistance. Such people tend to develop type 2 diabetes in future. Now I'm going to end this video here, and in my next episode I'll be talking more about the treatment for diabetes. What are the treatments? What should we do, or what should a patient do if a patient is being diagnosed with type 2 diabetes? And also, I'll be discussing the diagnostic factors. How can we tell that someone actually has diabetes? All this will be discussed in my next video. Stay tuned and watch out. Thank you.